Okay, good day nurses. For today, we will discuss COVID-19. Yes, you are familiar with this viral infection. Now we will talk about it. So let us first define what is COVID-19. So COVID-19 is a viral infection caused by SARS-CoV-2 viruses. So alam mo na yan, di ba? Sobrang naging familiar na tayo dito sa COVID-19. And this COVID-19 virus, okay, it primarily infects our respiratory tract. Pero in severe cases, pwede niya din maapektuhan yung iba't ibang organ sa ating katawan. Okay? So, ibig sabihin yan ba, ma'am, nagkokos din siya ng multi-organ failure? Yes. Okay, ganun kalala ang SARS-CoV-2 virus. Then, it can primarily spread through droplet and airborne transmission. Yes, dalawa po ang kanyang mode of transmission. It can be droplet and airborne. Okay, pag droplet transmission yan, paano nangyayari? Usually, ang infected na patient is na-transfer niya ito through what? Kapag siya ay umubo, coughing, sneezing, or merely talking. Okay? Yun ay natatransfer niya sa ibang tao through coughing, sneezing, and talking. Okay? How about airborne? Okay? Pag airborne naman, guys, magkaiba sila sa droplet. Kasi pag sinabing airborne, ito ay mga tiny particles. Okay. Yung tiny particles na yan, tinatawag siyang aerosols. Okay. That aerosols will remain suspended in the air. Okay. Gaano po katagal, ma'am? Okay. Usually, it can suspend in the air for minutes to an hour. Lalo na kapag yung lugar na yon is what? Poorly ventilated. Ano pa? Pag crowded yung area na yon. Okay? So, yun. So, kung ang mode transmission niya ay through droplet and airborne, ano din ang proper PPE na gagamitin natin? Okay? You know that for your droplet precaution, ang ginagamit dyan is the surgical mask. While for your airborne precaution, ang ginagamit dyan is N95 mask. Diba? But pag ang topic natin ay COVID, guys, as healthcare provider, ang ginagamit nating respirator is the N95 mask, okay? Rather than the standard surgical mask, okay? So, moving on to its risk factor, okay? Itong mga risk factor na to is what? Ito yung tinatawag natin comorbidities natin, okay? Number 1, we have unvaccinated status, okay? Bakit risk factor unvaccinated status? O, di ba pinapa-record tayo magpa-vaccine noon? Kasi pag wala tayong vaccine, walang mape-perform na immunity sa atin. Ano pa? Kapag hindi ka vaccinated, mas mabilis or mas higher yung chance na mas dumami yung viral replication sa loob ng katawan mo kapag na-acquire mo tong virus na to. And you know that vaccination, di ba guys? When we talk about primary prevention, okay? Sa vaccination, ano ang ginagawa niya? Di ba? It stimulates antibodies and especially the memory cells, di ba? Na kapag yung memories na cell na yun, natandaan yung certain virus na yun, makikilala niya na kaagad, thus reducing the disease severity. That's why sobrang halaga na magpa-vaccine tayo noon. Kaya yun yung, and of course, to achieve the herd immunity. Okay? Another risk factor, older age. Okay? Age greater than 65 years old or mga geria patient natin. Bakit? Okay, kapag matanda, guys, or older adults, okay, mas weak ang kanilang immune system, right? And then, dahil medyo may edad na sila, possibly rin na-reduce na ang kanilang lung reserve, okay? Lung reserve, ano pa? Madami silang chronic diseases, di ba? And mas slow ang kanilang recovery compared to young adults, okay? That's why, guys, kung mapapansin nyo sa mga risk factor, bakit included ang age? Because age, okay, is one of the strongest, okay, predictors of severe illness, okay? Trivia yun, okay? Then we have also chronic conditions like DM, the diabetes, lung disease, and renal failure, okay? Pag may diabetes ka, okay, decrease ang inflammation, ay increase ang inflammation, ano pa, delayed ang healing mo dyan. Okay, how about lung disease? Okay, for example, meron kang COPD or asthma, okay, so those condition have already a decreased respiratory reserve, okay, then renal failure, okay, because kidney disease also weakens our immunity, okay, causing what? Mga maraming problema, like for example, to name a few, it will cause fluid and electrolyte imbalances, okay, thus increasing our risk for complications. Then next risk factor, we have obesity, okay, bakit naman ma'am? Okay, 'di ba guys, hindi naman natin mapagkakailan na kapag medyo may katabaan tayo, restricted ang ating lung expansion. Okay? Thus making more difficulty breathing. Masirap silang huminga, okay? Then of course, we have pregnancy, okay? Pregnant women, ano bang nararanasan nila? 'Di ba? Nararanasan nila yung mga different physiological changes sa kanilang katawan, okay? Increase ang kanilang oxygen demand kasi yung demand na yun is para sa sarili nila at para sa growing baby. Ano pa? Okay, reduce din ang kanilang lung capacity kasi merong lumalaking uterus. There is enlarged uterus, okay? Then other physiologic changes that happening when you are pregnant, okay? Now, moving on for its assessment findings, okay? It can vary, okay? And include fever, okay? Diba? Yan yung mostly, okay? At una nating nararamdaman kapag tinamaan tayo ng viral infection. Due to what? Due to our body's response to the inflammation na nangyayari, okay? So, tataas talaga ang temperature natin. Then, fatigue, okay? Usually, di ba, yung mga COVID patient natin, ang complaints nila, nanghihina sila, wala silang energy. And of course, dry cough, okay? Non-productive and mostly persistent pa yung cough, non-productive cough. Then, of course, dyspnea, difficulty breathing, okay? Then, the loss of taste and smell. O, 'di ba? Pag naramdaman na natin 'yan, hala, COVID, sabi na noon sa atin, 'di ba? Guys, trivia that loss of taste is ang tawag siyaan is hindi ko siya mabigkas. Ayoko siyang bigkasin, baka pagtawanan niyo ako. Okay, that's the loss of taste. And then, when we say loss of smell, ang tawag naman dyan is anosmia. Anosmia. Okay? So, COVID-19 also affects our olfactory nerve rin pala. Okay, di ba? Kasi taste and smell. Then, severe cases, it can lead to different complications like respiratory failure, ARDS, and multi-organ failure na na-discuss na natin yan during our first meeting. Okay? Right? Okay. Now, moving on to our interventions. Okay. Number 1 is to implement infection control precautions. So, ma'am, ano yung mga different infection control precautions? Okay, we have here, we implement airborne and contact precautions with eye protection. The use of these PPEs, we have the N95, the gown, the gloves, and face shield. Ma'am, ang dami naman yan. Yes, di ba, naka-full PPE yung mga healthcare workers natin noon, di ba? Kasi di ba, nasabi natin kanina na ang mode of transmission ng COVID-19 virus is through droplets and airborne, di ba? Okay, kaya complete PPE ang ginagamit natin. Okay, then next, we avoid giving inhaled medications using a nebulizer which can aerosolize and spread the virus. Okay, instead, we administer inhaled medications using a metered dose inhaler. So, bawal gamitin ang nebulizer kasi 'di ba, ano ba ang nangyayari sa nebulizer, 'di ba? Yung nebulizer, tineturn niya yung liquid into what? Okay, kino-convert niya yung liquid into fine mist medication, okay? And that mist, okay, can carry viral particles into the air. O, di ba, alam mo na, airborne ang mode of transmission ng COVID, thus increasing the risk of infecting other people, di ba? Especially yung mga, kung pinapagamit sa ibang tao, yung nebulizer na yan, or may kasama ka sa loob ng room na nagne-nebulize ka, okay? Ganon. So, increasing the risk. So, instead, ang gamitin natin ay metered dose inhaler. Okay? Para diretso mismo sa lungs ni patient yung medication, okay? Thus decreasing the risk of spreading viruses. Okay? Next, we support the oxygenation. Okay, we will administer a non-invasive ventilation as needed. For example, we have the CPAP, also known as your continuous positive airway pressure. Okay, then also we have your BiPAP, that is bi-level positive airway pressure, and the use of high flow nasal cannula. Okay, si CPAP guys, it provides letter C, constant. Okay, it provide constant pressure throughout breathing cycle. Okay, throughout inhalation and exhalation to keep the alveoli open. Okay, while your BiPAP naman guys, bi o dalawa. Okay, bi. Okay, dito naman it provides higher pressure, okay, during inspiration and lower pressure naman during expiration. Okay, mamaya let's discuss it. Okay, mamaya after matapos nitong discussion. Then, for our high flow nasal cannula naman, ang dinideliver niya yan, anong pinagkaiba niya dun sa regular na nasal cannula? Si high flow nasal cannula guys, okay, it delivers heated, so warm siya, humidified oxygen, okay, at a high flow rate. Sobrang taas, up to 60 liters per minute. Okay? So, yan. Mamaya din pag-usapan natin si high flow nasal cannula. Then, we notify the healthcare, place the client with severe hypoxemia in a prone position. Okay, this is to increase the perfusion of a larger posterior surface of the lungs. Okay, bakit prone position, ma'am, like this one? Okay, we will utilize a prone position, okay? Kasi guys, on the posterior back of the lungs, so sa posterior ng ating lungs, mostly nandiyan yung mga alveoli natin, okay? Bakit prone? Para guys, yung mga alveoli naman dito sa likod ni patient, hindi siya makompress ng ating abdominal organs or ng ating heart kapag naka-supine position tayo, okay? So, ipoprone natin siya para maging open, okay? Yung posterior alveoli, thus decreasing the alveolar collapse. Okay? Then, para mas okay ang oxygen gas exchange yan sa posterior lungs ni patient. Okay? Kaya, sa ARDS and COVID-19, ang positioning dyan is prone position. Okay? Then, we notify the healthcare provider for hypoxemia that does not improve with oxygen therapy. Anong sinabi natin kanina na if the hypoxemia does not improve with conventional oxygen therapy, anong tawag dun? That's a refractory hypoxemia. Okay? That indicates acute respiratory distress syndrome. And tapos na natin yan pinag-usapan, it is the hallmark sign of refractory hypoxemia. Ibig sabihin lang yan guys, kahit bugbugin natin siya ng napakaraming oxygen, conventional oxygen, hindi pa rin natitreat yung hypoxemia ni patient. Ang tawag dyan, refractory hypoxemia. Okay? Then we also prevent complication. Okay? We administer antivirals. Okay? Yung mga severe, okay? Antivirals yan. Okay? Okay, ano bang ginagawa ng mga antiviral? It inhibits viral replication, di ba? Then, we also administer glucocorticoids like dexamethasone to reduce the disease severity. Ang purpose naman, guys, ng dexamethasone is to suppress the excessive inflammation na nangyayari kay patient. Okay, kung masuppress natin ang excessive inflammation, maaari natin ma-prevent na mag-progress into ARDS, di ba? And respiratory failure. O, alam mo na kapag ang nangyari sa ARDS is severe inflammation. Kaya nagbibigay sila ng dexamethasone. Also, we administer antipyretics, of course, for fever. Okay? One example is acetaminophen or paracetamol. Then we administer anticoagulants as prescribed. For example, we can give enoxaparin, okay, give as ordered to prevent the formation of clots due to increased risk of deep vein thrombosis and pulmonary embolism risk. Okay, para maiwasan yung complication na yan because COVID-19 also increases, okay, abnormal blood formation. Bakit ma'am? Bakit biglang may abnormal blood formation? Okay, mainly due to the inflammation na nangyayari sa katawan ni patient. O, kapag may inflammation yan, okay, it can cause endothelial injury. So, para maiwasan natin yan, may mabuong clot formation, we administer as ordered anticoagulants. Okay? Then, we also have here the cytokine storm. So, we monitor for cytokine storm. It is a severe inflammatory response. Okay, nang nangyayari kay patient high fever and nag-chills na siya. Okay, mama, ano bang ibig sabihin ng cytokine storm na yan? Okay, ito guys, yung nangyayari kapag merong excessive immune response. Okay, di ba ang alam mo na ang cytokine is an example of what? Inflammatory and mediators, di ba? So, ibig sabihin guys, pag sobrang dami nang na-release na cytokine or yung cytokine storm, may nangyayari talagang excessive immune response sa katawan mo. Okay? Causing, okay, so sobrang daming na-release na cytokines, anong gagawin ng cytokines na yon? It can damage its own tissue and organs, okay, sisirain niya, okay, lahat, okay, and this is a medical emergency, okay, kaya that's why we monitor natin siya for cytokine storm. And lastly, vaccination and education. So we encourage COVID-19 vaccines and booster shots to reduce the risk of transmission, severe disease, and death. And of course, para ma-achieve natin yung herd immunity. Then, reinforce hand hygiene, masking, social distancing to prevent disease transmission. Okay, natutunan natin talaga yan nung pandemic. Hand hygiene, may dala-dala tayong laging alcohol. Then, we wash our hands with soap and water. Then, nagmamas talaga tayo. Then, usually, face shield, pina-require din sa atin. Then, social distancing to prevent disease transmission. And kapag masakit ka na, we isolate. Mag-isolate din tayo. Alam na natin yan. Okay? Now, let's discuss the CPAP and BiPAP. Okay, this is a non-invasive, okay, isa na yun, sabi niya, non-invasive ventilation na ginagamit sa COVID-19. So, let's differentiate CPAP and BiPAP. Sabi ko nga kanina, CPAP is a continuous positive airway pressure. Ito siya guys, this one. Okay, ano pang ginamit na term natin kanina? Constant. Okay, it delivers air pressure at a single set level. So, isa lang ang setting niya. Okay, that stays consistent during sleep. Okay, not as good for accommodating breathing changes, but it is generally recommended for patient who have OSA, your obstructive sleep apnea. Okay, kasi continuous nga yung binibigay niya and consistent yung binibigay niyang airway pressure. Then it is typically less expensive. Okay, inhale and exhale, constant set of pressure. So isang setting lang ang ginagamit sa CPAP, while for your BiPAP, dalawa, because it is a bi-level positive airway pressure. Two different pressure settings for inhalation and exhalation to allows for lower pressure during exhalation. Diba? Higher pressure during inhalation and lower pressure during exhalation. So ginagamit naman si BiPAP for more complex breathing problems such as your central sleep apnea and heart or lung neurological disorders that requires additional airway support during sleep. Okay. You have congestive heart failure, COPD, Parkinson's, and ALS. Okay? So, inhale, constant set pressure. Exhale, lower constant set pressure. So, dalawa ang setting ang ginagamit sa BiPAP. Okay? Yan. Yan siya. Okay. For your high flow nasal cannula naman, anong pinagkaiba niya dun sa regular na nasal cannula? Okay, sabi natin kanina, it can deliver a heated, okay, warm na siya, humidified oxygen with a flow rate of 60 liters per minute. Yes, ganyan siya kataas. That's the name high flow nasal cannula. Then it also provides very precise FiO2, your fraction of inspired oxygen, of hanggang ilan? 21% up to 100%. Okay, benefit niyan, syempre dahil nasal cannula yan, pwedeng kumain dyan si patient at pwedeng magsalita o magkwento. Okay, that's all guys for our COVID-19. Okay, I hope you learned something. Thank you and God bless.